So, doctor, they say that one image or worth a million words. So, although I'm reluctant to see some images, I'm gonna ask you to show us some procedures that really did not get right.
Didn't go well. Yeah, so viewer discretion. Some of these things
Advised.
here. Yeah, but you don't want to be in these situations. Now, these are patients that shared their story with us through the Fight to Fight program. So obviously, I'm allowed to show their pictures, but you know, I really feel sorry for this. So one of the things that we're seeing, and we talked briefly about transplants that are very poorly done. This is, I mean, of course, you don't know what you're looking at, so I'm going to sort of guide you through it. When you do a transplant, you know, it's important to design a natural hairline that will fit well with the patient's facial features and everything like that. And of course, you want to create some kind of hair density. Now, you see here, it's easy to tell. First of all, there's a big gap here between the hair and the transplants. And these hairs are very far apart, so this is never going to look with any kind of thickness. And when this grows, the patient is going to have a hard time making this look natural and blend it to his hair because there's really no connection here. So this will have to be fixed eventually. The problem is, again, sometimes you can fix by putting some hair in between, you know, even moving them around. But then that's another thing we're seeing, and this is very graphic. This is called over harvesting. So one of these little incisions is one we call FUE incision. You go with a small punch and you harvest the hair. So this is what people like that call, or these doctors are calling it non-invasive or scar-free or you know, superficial surgery. Obviously, you can tell that this patient is never going to heal very well. The hairs that have been removed here are gone, and then you end up with results like this, where this is never supposed to be like that. When you take too much from that donor zone, you end up with thinning areas. So if this patient needs another transplant in the future or needs hair to fix what was done, what am I going to do? The more I take from here, the less is going to have hair there. So it's really no way to fix this, and that's what we see with the FUE. And amongst us surgeons, we say, you know, a strip procedure, the older technique, it's easy to fix because you still have a lot of hair remaining. A complication from an over harvested FUE procedure is almost impossible because your options are very limited.
So it should look like the top, right?
It should look like the top. It should look maybe a little bit thinner because you do take some hair, right? But the cause of this, the problem with this is, number one, too many hairs were taken from that. Number two, too many hairs too close together. And so you have gaps, you have thinning areas all over. And if you take any more hair from there, then you're increasing that empty space, right? So the distance between each hair becomes bigger and bigger and bigger, and then you start to see through, and that's not what you want, right? And so it should look natural. It should be able to keep your hair this short without seeing really any scars or very few scars. So FUE is not scar-free surgery. There's no such thing. You're going to create dots, thousands of dots. My job is...
Is that painful?
Not really. No, it's not. I mean, that's... If FUE has advantages, I think are two. Number one, it's a little less painful afterwards. I've had procedures myself, and they were done with the strip method. It's not painful either. I wouldn't say it's painful, but you feel that incision there because there's a cut and there's some stitches, so you feel some soreness afterwards. Very easy too. Nothing.
But not that when the procedure is being done.
Oh, no. During the procedure, you don't feel any pain. Yeah, no, that's, if you're feeling any pain during the surgery, something went wrong. You know, we're supposed to keep you very comfortable. And, you know, we pride ourselves on providing very good experience, comfortable procedures for patients. But, yeah, afterwards, the FUE, the recovery is quicker because there's no stitches. The donor zone heals very quickly, and it's much less painful. But my job is to make sure that as I am harvesting these hairs from your donor zone, that I spread them out randomly and I don't take too many from any given area, because if I do, then you end up with this. And that just kills your option. If you look closely, this patient is having some thinning up here already. So hopefully he's on medical treatment to prevent that from getting worse, because if he ever needs another surgery or wants another procedure in the back of his head there, the crown, he's not going to have any more hair to do. So this is what we call a one and done, right? It's one time and then you're done. You don't have no other options. The only thing you could do for a patient like this is to maybe tattoo in between, put some dots in there. We'll talk about it's called scalp micropigmentation, or SMP. Could be a good technique for these situations, and I'll show you later a situation where it's not a good technique. So, like everything else, there's the good side and the bad side. That's what we see sometimes also when you inject too much medication to the scalp. When you put these grafts very, very close together, you end up what we call tissue necrosis, so death of the skin, right? You can see here there's this dark area right there with a clear center. That skin is dead. So this patient in a few days will have a big wound there with tissue death. None of the grafts will grow in that area. And he's going to have to go through some very extensive long-term treatment for this until it heals back in. And then we will have to go back, as long as there's enough donor zone, obviously, to fix it and to put hair in there. But those are things that can be avoided. I know that there's a risk of this happening in my hands. I mean, everybody can have this. But when I bring someone into the operating room, I'm already predicting this and I'm avoiding it in every way I can. Luckily, I've never had this happen to me. Doesn't mean that can't happen tomorrow, but I know that this is a risk. So in my mind, I'm already preventing it as we go along, right? So, but these people, unfortunately, they don't know better, or they just take it to an extreme. This is the other side of the scalp micropigmentation. If you look closely, these are tattoo dots that were done to simulate a hairline. Now this patient lost hair, and then this is not natural, right? I mean, it doesn't look good. In this situation, it'll be easy to fix. You can come in and you can transplant that area and put hair in there. Look, apparently he's not had any transplants done there. So that's a sort of easy to fix situation. But how can you do that to someone? How can you think that this is going to look good long term, right? So if you recommend this to a patient, in my mind, either you don't know any better, or you're just trying to pay your bills that month and you're trying to get everybody to do whatever, right? Mm-hmm. Because you can't really think that this looks good when you do that to a patient, And so
that's my definition of a studge.
Yeah. I prefer to think that the person that did this did not understand the implications than to think that they did it on purpose to, knowing the risks, but who knows, And again, a patient doesn't know. He's looking to a nice, deeper, darker hairline, maybe some more illusion of density. It doesn't look good, right? So those are some of the complications. There's again death. We're giving people drugs during the procedure, so you have to make sure that their cardiovascular system is protected, their respiration is protected, that their medical history, their allergies. I mean, this is a procedure. You're gonna,
When's gonna be your next engagement? I heard that this African American conference in Salvador, in Brazil.
Yeah.
Are you gonna be there?
I am. So very excited. They invited me to be a part of it. It's the first workshop dedicated to Afro hair. Salvador is a city in Brazil that has a very big heritage. African heritage. Lots of African Brazilians. There. And so I'm looking forward to it. And when you transplant Afro hair, it has certain nuances compared to Caucasian hair that you have to follow. The hair is completely different. The hairline design needs to be different. Everything is different in the procedure. So it's cool to see this because it's a specialized sort of area of what we do. And we have a lot of patients that are African Americans. I have a picture here that I can show you. So again, to start, this is what the results should look like, right?
That's what I'm about to ask you, because we had a lot of malpractice, so I don't want our viewers to end up with the kind of a bad taste in their mouth. Yeah. So this is how it should be done, right?
This is how it should be done. I mean, it looks very soft, right? It looks really natural. Look at the patient, he's got a smile on his face. He looks in the mirror every day, he's happy, right? It's not a wall of hair. There's some see-through, but natural. We all get older.
Compared to what it was?
Right. And so this is what we need to give patients. And it's possible to do this consistently if you do it the right way, And so that's what you should have if you're looking for a hair transplant procedure, whatever your situation is. And this is an African-American patient. So talking about the Afro hair, a lot of African-American ladies have hair loss around the front because they pull their hair tight when they're young. It's called traction hair loss, and transplants are great. And you can see here how soft that hairline is. Is not anywhere near what we showed before, where the hairs are spread apart. So this is really natural, stylable, and that's how it should look, you know, all the time. So
that's it.
that's all we want for you. Results like this. So